At what age did you start experiencing when it was more noticeable?
Till 35, it was all fine. But somehow the thinning happened gradually over the years.
Yeah.
I never have seen my hair falling a lot,
Yeah.
even by combing or probably having aftershower. Once I had approached a doctor way back, he gave me some ampules, or I couldn't afford it. I
Yes,
am keloid prone, so
Correct.
I keep asking different doctors. All say the protocol says no.
Doctors also sometimes do not encourage to get the procedure done, thinking that okay, it can cause keloidal tendency because you have the hypertrophic scars and all of that.
That's scary. It's a nightmare. Even 1% of a risk is too much. At last, I came across a friend who did this. That's when I thought, like, now I must take a chance. No, I showed my case, did a patch test, waited for 10 days. It was healing properly.
How was your overall mindset while the procedure was happening?
Like anybody, you have your heartbeats high, but then that's just for a week, it gives you years ahead.
Dubai, we know it's very common. Transplants happen. People even go to Turkey.
What I advise people is to do where you live. Do not do a one-day sitting.
When did you start appreciating the results?
The third or fourth month onwards, it started covering up. It contributes indirectly to your life. You have more confidence. Not only the hair care, now you start your skin care. You start your diet. You want to be on shape. People start saying, oh, you look different. It's done well. There are a few things which you spend for yourself, so this is one of them. Now I'm 48 right now. Since a year, I'm back to 35, I guess.
Hello, Sam sir. Welcome on Beyond the Mirror.
Thank you, doctor. Thank you.
Thank you so much. It's a pleasure to have you here with us.
Pleasure is mine. Yeah, thank you.
So as you know, we've been, talking to all our guests where they've shared their hair restoration journey and how initially they started with the hair loss and how they identified this and, how did they eventually get into this procedure. With you, there are two key factors, I think, which would be very special in the conversation. One, because you've been living here for years, so you've seen how Dubai has evolved. So we will really want to discuss that before we get into the hair journey. So it's been how many years you are in Dubai?
I've been here since my childhood. I was not born here though.
Okay.
Back in India. Then I came here for my preschool. Started from the preschool here. College was in India, higher studies. Then I came back here when I was 21, 22.
Okay.
So post 1997, I'm here permanently, like as an adult, if you could say.
Right.
As a working class, or initially I was with my father's business for a couple of years. Then I thought I must work somewhere to get some more professional, or signed up a job. I mean, I got a job with an airline, and then worked there for 15 years.
Okay.
Then actually I left the job and came back and took over the business which my father was running.
Okay.
So currently I'm doing that. Going pretty well, not bad.
So I think most of the years you mentioned you've been in Dubai. A lot of people blame Dubai water to be the major reasons why they started experiencing the hair fall and the hair thinning. What is your personal experience?
Well, I don't know, is it a myth or anything, because you find there is no such study that Dubai has got more bald people or people losing hair. I mean, there is no such statistics available.
True.
What, in my case, I never have seen my hair falling a lot, even by combing or probably having aftershower on your towels. No. But somehow it got, it started disappearing. You don't really, I never saw serious fall.
Yes.
But somehow the thinning happened gradually over the years. So that's when.
Did you have a genetic history in your family towards your mom's side or your dad's family?
Oh, well, yeah, my mom's side, my uncles are all bald.
Okay.
My mom's brothers, she's got 4 brothers, so all of them are bald. So I keep blaming them. It's all your heads, what came to me.
Right.
But then, right now, it's a travel back.
Yeah. At what age did you start experiencing when it was more noticeable?
Well, I see my pictures back now when I was 36, 37, 35, till 35. It was all fine. But then the light started appearing, So then it started expanding. So I think now I'm 48 right now. Since a year, I'm back to 35, I guess. Not so much, but a lot of people appreciate this,
Yeah.
you've changed.
Yeah. In the initial stage, any treatments that you're taken?
Well, once I had approached a doctor way back.
Okay.
I don't know, he gave me some ampules or
Mm-hmm.
I couldn't afford it
Mm.
way back. It wasn't a surgery though, or transplantation, but
Yeah.
then I just left in between, I couldn't afford it at that
Right.
point of time. I
Right.
was working then,
Yeah. And also with hair, you can't be very regular with all these medications. You would not even prefer
Well,
taking it.
what not oils? I sell
Yeah.
myself oils, that's my business too, hair oils.
Okay.
Now I'm doing good, better.
Yeah.
People who have seen me after a long time, I say this is the product you gotta buy. I've been using this. So why don't you try this? Say yes. I show my old photos, sell myself. So this is where I'm tricking them, somehow.
And what is that one thing you would, want to tell the viewers? Because a lot of people, because Dubai, we know it's very common, transplants happen. People even go to Turkey. What do you feel? Is it more comfortable when you are closer to home and you get it done, or because a lot of people do consider, going to Turkey?
What I advise people is to do where you live. Say, a lot of people, there's an affordability issue now in Dubai. Everybody can't probably do so, but such people have long leaves. So I tell them, if you are going to India for 3 months, do it from your day one. Say, if you are doing, and then do it in batches. Do not do a one-day sitting. Turkey, no way. I wouldn't have traveled for that. No, just for some money, maybe not. But then it depends to people how do they want to do it, So my thing was, I get home in 10 minutes after the procedure from here, take rest for the first 2-3 days. No exposure of dust or probably sunlight was important. So in a travel, I don't know how successful is that going to be. Then plus you will be in some hotel in Turkey alone. You will be like, it's horrifying even if they do it in few batches,
Yeah, that's right.
It is isolated kind of a thing, You don't have a company for this. No friends are going to come and, do a transplant together.
Yeah.
So this is how it is.
So when did you start your research, or when did you actually realize that you want to, opt for a hair transplant, or like somebody guided you from your family or somebody known who had done this procedure?
Not that, but then always it was there in mind. But then I went to, whenever I could have a chance to meet any dermatologist, I used to ask this.
Yeah.
As you're aware, I am keloidal, I am keloid prone. So I keep asking different doctors, all say the protocol says no. And then if you start having a keloid on your head, then it's like scary. It's a nightmare. So even 1% of risk is too much. So I kept opting it off. Though I had, my finances were okay then, But then off lately, at last, I came across a friend also who had a keloid and who did this. That's when I thought like, no, it's enough. I must take a chance. No, he also said this. Well, it doesn't affect your head. The next week I'm here. To be frank, I did not have this in my mind. So Facebook, this was the first form submitted with Ashwin. I got a call immediately. Came here. This was my first consultation. I didn't look behind. I just got the assurances from Dr. Abhishek and yourself. I showed my case, did a patch test as you all are aware. Waited for 10 days. It was healing properly. Then what happened. We just began with it.
No, but that's a very important point which you mentioned, because a lot of people don't take a step forward, especially when they have some skin tendency.
That's right.
Most doctors also sometimes do not encourage to get the procedure done, thinking that, okay, it can cause some keloidal tendencies because you have the hypertrophic scars and all of that.
That's
So
what, yeah.
I think both important, of course, a mindful doctor and also the cooperation of the patient. Because I remember we took a very cautious approach with you.
That's
We
what.
first thought of a small patch test.
Mhm.
First, see whether it works. Is it developing any scarring or keloid?
That's what.
That needs a lot of patience also, and the trust, which I think
Mhm.
a patient needs to have. And I think that's really. So I believe when we did the patch test with you, that was like just a few
Yeah,
follicles
just
and a
just
small
a
area.
crown area.
Yes.
I think doctor implanted some 100 follicles
Yes, yes.
initially. I was just seeing the healing part.
Yeah.
It was absolutely fine.
Yeah.
Then I didn't even check any other clinic, to be
Yeah.
frank with you.
Yeah. So when we started with the procedure, obviously all the patients have some amount of anxiousness, whether to go right from the safety aspect, and in your case, because it's a little unique case because of the tendency of keloids that most doctors did. I mean, you did have that fear. How was your overall mindset while the procedure was happening? Did you have that fear while?
Well, like anybody, you have your heartbeats high,
Yeah.
especially you see a lot of, blood.
Yeah.
You take pictures of your own scalp, and then I send it to my closest friend. They said, "No, I'm not going to do this." Like, potential candidates who
Yes.
are, no, I'm not going to do the seeing the
Yeah.
blood thing. But
Yeah.
now, then a lot of them are confident.
Yeah.
But then that's just for a week, it gives you years
Yeah.
ahead. So that's
Right.
worth
Right.
experiencing, even
Yeah.
if there's a little bit of trauma for 3 or 4 days.
True, true. I think in your case, we had planned it a little more slow and systematic. It was into phases.
Yeah, it was. My first session was split into 4 days within a week. Where, what do you call this? The hairline.
The hairline, the front
Yeah,
was done.
the hairline was done. It took 4 days and four sittings.
Yes, 4 consecutive days, I think. Yeah.
October 2023. Then I came after a month for the middle part.
Yes.
That's November.
Yeah.
Then the crown finally April 2024. Yeah.
Later.
So right now I'm altogether 1 year, 2 months, I guess. Yeah.
I think with your case, we were a little more cautious because when we extract from the donor also, since most of the previous consultations that you did and the doctors didn't recommend, because if there is a single day long procedure, or if you're going to, over harvest, or if the wounds come very close to each other, that's where the risk of the keloid to form or the scar to form is there. Yeah. So I think both the doctors had decided that they'll do it segment-wise.
That's right.
So the skin elasticity doesn't compromise. There's no risk of scarring.
It wasn't. There was no stress on the donor that way. So it gave it some time for healing, and then we started extracting slowly. So I think the entire, it was not disturbed a lot.
Yes,
so that was a concern.
But I remember while the procedure was on, Dr. Piyush had mentioned to me he was using like a 0.7, a very micro punch. Because I would come and just check, because the initial conversation was, between you and me, where you had shared your concerns about the keloid. So, I think the doctor was very confident that if you use such micro punches, the patient will have absolutely no worry about any keloid forming. And that's what was our stress also in the initial 2 to 3 weeks during the patch test phase. But since that went successful, I think then when the doctors were confident that yes, we can do the whole head.
Yeah. If you Google, you'll see a lot of pictures, probably on like a facial or a head keloids. There are pictures available.
Yes.
That's so scary.
That is scary,
so nobody would take a chance.
Yes. Because if you see all this on YouTube and videos, of course, it does scare you.
That's what I've been seeing this, since not just before this, over the years of time, at times you feel like you don't take pictures, when you're bald. You don't take selfies. You just run away from the camera. So it's always a concern when you live when you're bald, you don't send your own picture to anybody.
When did you start appreciating the results?
Well, I think after the first, after October and November, I think the third or fourth month onwards, it was started, it started covering up.
Yeah.
Now I want to do it every year, wherever possible.
Yeah. How do you think, because all our patients do share, some stories, and every story has its uniqueness, something that you want to share with us, where, of course, after the hair was fully grown, how did you feel? How did it change things in your life, both personally, professionally?
it contributes indirectly to your life.
Yeah.
You have more confidence. Not only the hair care. Now you start your skin care.
Yeah.
You start your diet. You
Yeah.
want to be on shape. There are a
Yes.
lot of things. Depending, it indirectly contributes
Yes.
to
Yes.
the rest of thing. The
Yes.
rest of the other part of your life. People start saying, "Oh, you look different. It's done well."
Yeah.
But then it's a very good transformation. You not only look after your hair, you look
Yeah.
after everything, and
Yes.
then you want to be more perfect.
You start
in
giving
life.
more importance to yourself
That's what
in
you
other
wanna
aspects.
more perfect. You want to be in shape,
Yeah.
So these things, it's really it was a really good experience.
Yeah. For a good quality transplant, because now people research a lot,
Mhm.
right? In your case, of course, there was a medical aspect, but in general, also people do research for a year or two before they decide, to go ahead with this procedure, and they shortlist a few clinics. What is your one advice? Three important factors that one must keep in mind to select a good quality clinic or a good quality procedure for themselves.
Nobody should finish their procedure in a day.
Yeah.
You must give time probably for the donor to come back.
Yeah.
Probably, I think, as the doctor said, there is a 25% of donor which has not even come outside of your donor area. So let that come.
Yeah.
Utilize that too. You while having your transplantation in some batches, it gives you
Yes.
that privilege.
Yeah.
If it's a one-day procedure, again, it's just one day over and out. So go for this. Who says this? Because
Yeah.
I've heard everybody saying you get admitted at 8 in the morning and 5, 6 you're out.
Single day procedures. Yeah.
So spend some more
Divided
money.
sessions. Yeah.
Get something for yourself. There are a few things which you spend for yourself. So
Yes.
this is one of them.
Right.
So
Yeah.
selecting quality should not be compromised.
Yes. So this is one thing. Yes, divided sessions. Apart from that, any two more factors that you can share with us, which were your expectations as well?
Well, you could say the clinic facility, the feel free, how well the crew members treating you.
Yeah.
Everything is important, like post-surgery care, like, anything, anytime. You must see them. How are they really professionally distant
Yes.
from you, or are they friendly? Are they approachable? Is a key factor too. And obviously, the quality, as said, the branding, go by the rating, go by the experienced doctors, see what they have done in the past. Do that homework. Whether, nobody should be a fresher that way.
Right.
See how is the industry
Experienced
doing.
doctors.
How is the others doing? Compare and decide.
Also, a lot of patients do tell us that because Dubai, you have different doctors from different globally people are operating here, but they have that little more comfort towards Indian surgeons. Do you have a similar opinion?
Well, yes. In that case, yes. Indians, we know among ourselves. We know that we probably have the same texture, or probably the same kind pattern of hair mostly, or at least the Indian doctors would have seen such hair patterns.
Yes.
It's always safe to do within our same ethnicity of the class of doctors even. So even I'm sure most of us being Indians, we will be comfortable with any Indian doctor rather than
Right. It was a very great conversation. Is there any message you want to give to the viewers who are in the research process, looking for this service? Anything from your end which will help them get that confidence?
A lot of people say, I don't need hair. I mean, I'm old right now. I don't need it. I want to correct them, It's not that. If you can afford, why not? I mean, you can roll back some years of your life, get back, bring your youth back, reinvent yourself. Go back to, grab some attention in between. These are some things you will enjoy, provided you're good, So everyone should consider who's got the scope of it, at least, the donor, everything. There are a lot of factors which probably, require as a requirement. Do it slowly, probably get a patch test done. Nothing, I mean, it must not be the same what happened with me. So everyone should know themselves more better, Learn your body, learn yourself first, do a test, slowly. Go ahead and do
Yeah.
this, you know.
Thank you so much, sir.
Thank you, thank you.
That was very insightful.
Thank you, ma'am, and thank you, crew members, for having me. Thank you, Ashwa Clinic. Thank you.
Thank you so much.
Hi, so today I'm going to discuss about Sam Angoor's case, a patient with a known keloidal tendency, which made this a high risk and a medically sensitive case for a hair transplant. To begin with, keloid is an excessive scar formation. It occurs when the skin heals aggressively after an injury, forming thick, raised tissue that can spread beyond the wound margins. In general, we avoid surgical procedures in such cases, but we approach Sam's treatment with extreme caution and medical precision. The first step, patch test and observation. We started with a patch test. Around 50 to 60 follicles were extracted and implanted. Then we monitored the area over a period of 6 to 8 months. Both the donor and the implanted zones were carefully examined. The result, healthy hair growth and no abnormal scar or keloid formation. Second step, full procedure. Mitigating the risk. Once we were confident that we proceeded with the full transplant, we focused on 3 key strategies to reduce any risk of keloid formation. Number 1, micro punch extractions. We used 0.7 mm conical punches with minimizing trauma to the skin and reducing the chance of scarring. Number 2, spacing and precision. Follicles were extracted with adequate spacing to prevent wounds from merging. Similarly, implants were done with a customized spacing across multiple sessions to distribute the trauma and avoid creating tension in one area. Number 3, understanding the scalp's advantage. Scalp is the highest vascular zone on your body, and also it is away from the high tension areas. This significantly reduces the risk of keloid formation. In Sam's case, the result was not just cosmetically satisfying, but also medically successful, proving that with careful planning and advanced techniques, even patients with a history of keloid formation can undergo FUE procedures safely. Thank you.